Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. As you know, every week I have a different guest on the program, and we talk about different healthcare issues, services, and programs that are offered here at KRMC. I've got a new doctor to introduce to you, so I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Sergey Sheleg. Did I say that right?
Yes, correct.
All right, good.
Yes, correct.
Thank you for being on the show today,
Thank
Dr.
you.
Sheleg. It's great to have you here, and
Thank you.
I'm just going to get to know you today too, because we haven't met until now. So that's great. And you're a family medicine, family practice physician up at Mountain Shadow Medical Center. That's,
Yes.
for folks that don't know, that's up on Wallapai Mountain Road.
Yes.
And how long have you been in Kingman?
For about 2 months.
2 months, so not very long. You're just getting settled. You shared with me before the program you're married and you have 2 children,
Yes.
15 and 7, so
Yes.
high school and elementary.
Yes.
And they're adjusting okay?
Yes.
So where did you come from before?
Um, Initially, I did research in Maryland. I used to work at National Institutes of Health in the field of molecular microbiology.
Oh,
Then we moved to Arizona. I used to live here in Arizona as well, and I did some research here. Then I got my residency in Ohio, and we relocated in Ohio. And after finishing my residency, we relocated back to Arizona.
okay, very good. So you said microbiology, that's a serious study. And then you went from there into family medicine. Now, how did you make that transition?
I'm a physician, I'm MD. I graduated from the medical school in Europe,
Okay.
and I practiced a little bit in Europe, and then I got a postdoctoral fellowship in research, in biomedical research in molecular biology, and I spent, I would say, like 2 years at NIH in Maryland, and then I got another position in Arizona, research position. And during this time, I prepared for my residency. I passed all required examinations, and I got my residency in family medicine in Ohio State.
At Ohio. Okay, very good. So then you came to Kingman. How did you find Kingman? Or did we find you? Or both?
As I told before, I used to live in Arizona.
Right.
I love this climate. I love the state, and warm state. Not so cold, no snow. My wife loved the state as well.
Good.
And during my last year of my residency, my wife decided to find some
Just look for
places
some
here to
better
relocate. Yeah, to relocate here. And I eventually found this position, and I applied by the end of 2012, and now I'm here.
Very good. Well, we're blessed to have you because
Thank
we
you.
are always needing more doctors in Kingman, especially family medicine. And family medicine is pretty broad. That means that you kind of take care of people with lots of different
Everything.
issues.
Everything.
Every
Everything,
head
yes.
to toe.
Family medicine is like primary care, and I see everybody from newborns till advanced stage people.
Oh, excellent.
And people can show up with any kinds of complaints.
Okay.
And my task, my job, to try to get to understand in a timely manner what's going on with the patient.
Sure.
And you need to know a lot of things. And during my residency, I had training in different medical fields like pediatrics, internal medicine, obstetrics, and gynecology, all actually related medical fields.
Wow, that's
And
what I'm saying. That's a big.
yeah, it's a broad medical
so
field.
you have to learn a lot
Yes.
about a lot of different
Exactly.
parts
Yes,
of the body.
exactly. And in order to understand what's going on with the patient, you need to get some idea, and definitely need to learn a lot of things in medicine.
Right.
It's true.
That's awesome. Now, are you working on Dr. Joe's side?
No, I'm working on family side with
So
Dr.
doc-
Fakri. Dr.
Oh,
Fakri.
okay, Dr. Keiko. Yeah, I call her Dr. Keiko. It's easier for me to say.
Mm-hmm.
But it's still the same. It's the Wallapai Mountain Medical
Yes,
Center up
yes,
there.
mhm.
So I've got your card you're nice enough to give me, and your phone number up at the office is 263-8530. So if people would like to make an appointment, just come and see you. And it is good to have a new family medicine physician because we've been sorely lacking. And I know it's been hard for people to get in to see a
Yeah.
doctor. So it's great that you're here and going to be
Thank
able
you.
to fill that gap.
Thank you.
So you had mentioned the microbiology, but you also shared with me before the show that you kind of like subspecialty maybe is people with headaches, depression, those kind of things.
Yes, I'm practicing family medicine, and I also have some areas of focus. I'm comfortable, and I would say like I'm comfortable to see patients with different types of pathology, but I would like to tell about areas of my focus as well. It's pediatrics as well.
Oh, pediatrics, okay,
Yes,
good.
and headaches, people with headaches, chronic headaches, high blood pressure, diabetes, and those are areas of my focus as well.
Okay, very good. And those are all issues that people have here in Kingman, I know.
Exactly. Yes.
Diabetes obviously is a big
Yeah,
illness that we fight here.
Yes, diabetes is getting more common, and during my residency, I got extensive training in managing diabetes in outpatient setting, and
Great.
I'm comfortable to see people with uncontrolled diabetes
Right,
and,
okay.
as well.
And that's the good thing now, I think, with diabetes is not only with medications, but with diet and exercise, we're able to make some changes and help people live a healthier, longer life.
Yes, exactly. Diet modification is a first step which needs to be done in managing patients with diabetes, and we actually this is the first thing I usually discuss with the patients who are diagnosed with diabetes, especially with uncontrolled diabetes. Diet is very important.
And diet and the exercise too, right?
Exercises
to get the weight.
as well. Yes, definitely. Unfortunately, patients with diabetes, they have some other comorbidities, and which prevents them from normal physical activity.
Oh, okay.
But
So it makes it hard.
So we are trying to help them as well
Very good.
in this way.
Now, headaches, what kind of, you mentioned headaches too.
Oh,
There's lots of different things that can cause headaches,
Exactly,
right?
yes. There are like different types of headaches, and each headache needs specific approach, and I do some workup, and sometimes we do some imaging study to rule out any dangerous causes of headaches.
Sure.
And we have a broad of medications to help people with chronic headaches as well.
So,
We can try them on different types of medications in order to
Okay.
find the best one for the patients.
okay. So, like I get headaches occasionally during monsoon season, pressure changes. So, but those kind of come and go. You're talking more people who have chronic
Headaches.
always headaches,
Yeah, some headaches can be very bad, and
migraines.
exactly, patients cannot work, cannot function, and I'm trying to help. I will try to. I'm trying to help them as well.
Sure. So, what can you share with me? What kind of things cause migraine headaches? You know?
Oh,
Well, sorry.
Yeah.
I know you know, but
yeah. It's a good question. There are different types of headaches, and sometimes it's very difficult to find the real cause of headaches, and sometimes we need to focus on lifestyle modification. Sometimes it helps. Some patients may require to be on chronic medications to prevent from headaches as well. And what causes headaches? It's not well understood, unfortunately, and there are some hypotheses, but unfortunately they don't completely understand the cause of headaches.
well, it'd be different things for different people too, probably,
Yes,
right?
Exactly, and some problems with blood supply to the brain, some
Okay.
functional issues, and stressful factors, and some patients may have headaches because of some musculoskeletal issues, chronic neck pain, sprains, all the stuff, and that's why.
So it's kind of, you have to spend some time with
Exactly,
them,
yes.
probably talking with them and helping identify exactly where it's at and how long. And
Exactly. So it may take some time to identify like what the real type of headache the patient is experiencing, and once we identify it, it would be I would be in a good position to prescribe correct medications
That's
for,
good.
for people.
Well, that's another reason we can be glad you're here, because I know friends who suffer from migraines, and I have been blessed, never had it myself, but so it's nice that we have some we can refer them to go and get and talk with you and see if they can't get some different medication or some things done that will help get rid of that, because it can be debilitating for
Yes.
people, like you
Yes.
said. They can't work, or can't be out, like too bright a sun outside can
Exactly.
affect it. So
Exactly.
lots of different things. So again, we're blessed to have you here.
Thank
So
you.
you've got your staff at Wallapai Mountain Medical
Mm-hmm.
Center, and they've all been there for a while, so they're kind of helping you get settled
Yes.
in and
Mhm.
getting adjusted, and that's a good thing.
Yes.
What have you been doing with your family yet for fun? Have you been out exploring Arizona too much?
Yes, it's as I told before, I used to live here.
Right.
I would say I explored a little bit Arizona. I've been to many places, and except maybe a couple of, I would like to visit the Arizona crater. I've never
Oh,
been
yes,
to this
yeah,
place.
that's fun out there.
It's not. It's close to Flagstaff.
Right,
I
yes,
remember.
yeah.
Yes, I've been to Sedona. I've seen the Grand Canyon as well. And we usually like traveling around Arizona, like
Good. Have you
2 or
done the
3
skywalk yet? Sorry.
Not yet,
No?
not yet. So, yeah, looks like it will be in my list.
On your bucket list. Yeah, there's
Yeah.
some fun things. And your kids are now at an age too where they can enjoy
Yeah,
those
they
things
they
too.
love traveling with us. They love seeing Arizona. Arizona is a gorgeous, beautiful state.
It is, yes.
I would say, in my opinion, I've been to different in many states of the United States, and I would say Arizona is the most gorgeous state I have ever seen in my
Oh,
life.
that's good. I'm glad you like it here too.
Climate is perfect, and Kingman climate is extremely good. It's not so warm, it's not so hot as in
Yes,
Phoenix.
right.
Like
Yeah,
compared
this is,
with,
I tell
with-
people
with
we're the
weather.
cool part of the state.
Exactly, yes. Climate is comfortable, completely comfortable.
Yes.
Summer is nice, yes.
Yeah, it's livable, and we have that dry humidity, so it's not so
Exactly.
bad.
My family, my wife, all my family loves.
Good.
Yes.
Now, where's your wife from?
Uh,
How did you meet?
oh, yeah.
Can we talk about that? I should.
Yes, yes. I think we've met when I just graduated from the medical school,
Okay.
and she's a registered nurse. She used to work in Arizona, and she'll try to find something here. And
Oh, good. Good. Yeah, we need more nurses too, so that's good. Have the whole family, get
Mhm.
you all involved. That's great. So I'm glad that you're liking it. And I know people, whenever you say, "Oh, I live in Arizona," they just assume you're talking Phoenix, and and they always, "Oh, it's so hot there," and I'm like,
Arizona,
no.
Arizona is a huge state. Yes,
It is,
I've been to
act-
many places of Arizona. It's
And they're very diverse depending on
It's
where you're
diverse,
at.
yes.
Yeah. And Kingman is nice. What I like is because we're kind of in the middle, so you can get to Phoenix easy, you can get to the ocean easy. Vegas is nearby, and Flagstaff if you want to go play in the
yeah,
snow. and-
excellent location. Excellent
Yes,
location.
yes. And like I tell people all the time, we have a perfect winter. You can drive up to the mountains
Exactly.
and play in the snow and then come back down.
Yeah, you can go to Vegas there is a lot of stuff in Vegas you can see as well.
Absolutely. Well, we're going to take a quick break, and then we'll come back and talk a little bit more about family medicine and some other things. So
All
we'll
right.
be back right after these messages. Welcome back to Your Health Matters. My guest today is Dr. Sheleg. He's our newest physician here at KRMC. Thanks for being on the program again. Now, one of the things that I forgot to ask you about, we were talking about this during the break, is where were you born?
I was born in a small country close to Poland and Lithuania. It's named Belarus.
Belarus, I've heard of that.
Yes, I went to the medical school in this country. I got some training in Europe as well.
Very good.
And as I told before, I got some training in the United States.
Right.
I did my postdoctoral fellowship in Maryland. I
Okay.
used to work at the National Institute of Health. And I also did some research in Arizona State.
Okay, now, is there a big difference between medicine in Europe versus United States?
Somewhat.
Yeah?
Somewhat, yeah.
Like what? What would you consider the
Um,
biggest differences?
Um, medical problems are the same.
Sure, no matter where we go, it
Management
means-
approach is almost the same. Medications are a bit different.
Oh, so it's the medications and prescriptions
Yes, exactly.
are different. That's interesting. Now, is that because, do they have a different agency, like we have, what is it, FDA that rules?
Yes, Europe is huge, many countries,
Sure.
and many medications. And maybe this is the reason why there are a lot of medications in Europe.
Okay.
Difficult to tell, but this is my opinion.
Yeah, right. Oh, absolutely. No, that's good. And I was just curious myself. So we were talking about your specialties as well. And pediatrics is kind of one of your
Yes.
what's the chosen specialties, or not a specialty, but where you like to focus.
Yes, exactly. And when I finished my medical school, I did my internship in pediatrics
Okay.
in my home country where I was born. And I think it was a major reason why I decided to do family medicine, because I can do pediatrics, I can do adult medicine,
Can see
and
'em
I
all.
love pediatrics.
You could actually follow a child all the way through to
Exactly,
adulthood.
exactly, from newborns actually. During my training in Cincinnati, for example, I was taking care of pregnant patients, and
Okay.
once they delivered babies, I was
You were able
taking
to.
care of those babies as well.
Oh, very good, very good. Well, and that's another, because I know, we only have 2 pediatricians in Kingman, which, we got lots of kids coming, and they have 650 births per year average in
I
at
was told about,
KRMC.
yeah, I was
Yes.
told about that, yeah.
So that's an awful lot for only 2 doctors to divide up between them. So that's great, again, to have another physician here that
Yes,
they
thank
can
you.
refer to.
I can see kids like just for well check, and I can also see kids with any medical issues.
Okay.
And this is
And we
family
talk
medicine.
about sports physicals as
Sport
well.
physical
'cause
as well,
that
yes.
time of year.
Yes, sport physical clearance is another part of my job. I can do this as well. And
Good. Well, and those are, again, good things for people to know, because we have, it's the fall sports season at
Yes.
school. Everybody's back in school, and football's starting, and then they got basketball, baseball, soccer, the whole thing, and they
Yes.
all need their physicals for that.
Yes, exactly.
And again, there's just a limited number, so the more physicians we have that can help with that, the
Yes.
better. Very good. Now, are your kids involved in sports at all?
my son, he used to swim a little
Okay.
bit. Yes.
Oh, we have a good swim team here.
Yes, and
So that's good. Hopefully he'll get
my
involved
daughter,
in that.
she's swimming as well.
Oh, good. And we have, of course, our beautiful pool
Yeah.
here at the Wellness Center, so they can swim year-round. I know our Kingman Dolphins, I don't know if you've heard that we had...
My wife, she's taking care of this.
Oh, good, good. Well,
Yeah.
and we just recently, I'm going to brag a little bit here, that Kingman now is the home of the youngest American to ever swim the Strait of Gibraltar. 16 years old. He just did that in August. That's Jacob
It's
Mayucci.
amazing. It's
yes,
amazing.
I know. He's only 16 years old,
16
and
years.
he did that. So we're very proud of that, and that he came from Kingman. So that's pretty awesome. And we have
It's
this
awesome,
the
yeah.
Dolphin swim team. So hopefully they'll get involved with that as well. Now, I know I bounce around a lot on this show sometimes, but you're talking about the pediatrics and the different issues. So what kind of childhood diseases and illnesses do you see the most, do you think? Or
I would say the most common problem is common cold.
oh, the cold, yes.
Sore throat.
Right.
Yes, ear problem, ear infection. It's a common problem, but sometimes kids may develop many medical problems, and family medicine is the primary care. As I told before, everybody can show up with any medical complaints. And our job to try to find out what is going on with the patient, whoever is it.
Yeah.
Either it's a child or adult people.
All the way through.
Yes, all the way
Well,
through,
and-
exactly,
And
yes.
it's good to have that broad a range, because we have a lot of different ages here in Kingman too. A lot of seniors, obviously, with a lot of retirees that have come to Kingman because of our perfect weather
Yes.
we were talking about earlier. And then our young people too.
Retired people, they usually present with chronic medical issues.
Right.
common set, high blood pressure, high blood cholesterol level, sometimes diabetes. And I'm comfortable to see and to manage such chronic medical conditions as well.
That's great. And like I said, it's good because we've been having a shortage of that kind of family practice that can see all ages and all different kinds of issues. So it's good to have someone like yourself here. So what we were talking also during the break, your pediatrics, the sports physicals we talked about, but I think there was something else you had mentioned, and now I can't remember what it
Depression,
was.
Depression, yes.
That's what it was.
I initially did my training in psychiatry, and I'm comfortable to see some patients. I'm comfortable to see patients with some mental diseases as well.
Okay.
And I can manage depression as well, and even now I have several patients in my practice here in Kilman with depression, and I'm
able to help them.
Yes,
and
I can help them as well.
Yeah, that's very important, and that's, I think, one of the issues that when people are in that place, a lot of times they think there's nothing they can do.
Exactly, there is a shortage of psychiatrists
Right.
as well in everywhere,
Yeah.
not only in Arizona, and people who are depressed, they usually see family doctors first.
Okay.
And I'm comfortable to try to help
Very
people with
good.
depression as well.
Very good. What kind of, is there medications that you can give them that help with depression?
Oh, it depends.
the
In many
person.
cases, I can try to address depression without prescribing medications.
Oh, okay.
There is psychologist service, counseling service, and we can try to manage depression first. But if a person is depressed, and sometimes we need to prescribe specific medications to improve this condition.
Okay.
And there are we have a lot of medications to manage depression, and management is based on, for example, we need to start patients on specific medication first. We need to wait for a couple, like from 2 to 4 weeks, to see the response. We can increase the dose, or we can switch to another different type of medications.
Okay.
It's like a process, and sometimes it takes time to find out the right, correct medication, which will improve depression as well.
Well, and I think, truthfully, from a layperson standpoint, the fact that you're offering them help when you're in that
Yes.
kind of a
Yes.
place, that's you feel like aren't any answers.
Yes.
So to know there's someone they can go to that's
Exactly.
going to help that helps just in that alone. Now I want to make sure I give your phone number again. It's 263-8530. You're up at Mountain Shadow Family
Yes.
Medicine, which is up on Wallapai Mountain Road, right across from Mojave State Bank's new office.
Yes.
So if someone wants to call and has some of these issues that they know, they can
Yes.
call you to make an appointment.
I will be
and-
happy to help
Good,
everybody.
that's great, and we're blessed to have you here, and we're
Thank you.
looking forward to getting to know you better, and we'll probably have you at some of our health expos that we do here to, again, people have a chance to get to meet you, and hope you and your family are all going to get acclimated and just fall in love with Kingman like the rest of us.
Thank you.
That's great.
Thank you.
Thank you again for being on the program. I hope
Thank you.
you'll join us again next week when we'll have another great guest on the program.